Welcome everyone. Very excited for our SeeBeyond seminar number 3. The topic is sweat, and we'll talk a little bit about the SeeBeyond 7 pillars, which many of you have heard about. And if you haven't heard about it, we're going to speak to you more of these. We're coming live. These are an experiment, or maybe a trial, I would say, to bring more education to our patients, to bridge that gap between a lot of what we're learning on the forefront of what we do and what our patients get to hear about and learn more. I think many of you have heard from me that the word docere comes from the Latin to teach. So we try to bring as much education as we can to our patients. I come from you today from downtown Scarsdale in the beautiful studio of Ed Morand. Many of you have seen from the invite. Welcome, Ed, to the seminar.
Nice to be here.
So glad to have Ed here. Just a quick 1-2, and Ed will have more chance to speak a little bit later on muscle activation technique. This was something I stumbled upon about 20 years ago, and like many amazing things that I stumbled across it from patients. And patient after patient came back to me responding incredibly well to a technique called MAT, or muscle activation technique. So much to the extent that in Scarsdale, I looked up a practitioner of muscle activation technique and was extremely excited to find that Ed is here in our backyard, and not only a practitioner, but really an expert in the area of muscle activation technique and so many other areas that I think benefit our patients in the area of movement. And I'll give Ed certainly more time to speak later, but just so excited that he can join me today. And maybe we'll jump right into it. I hope I can share my screen. So Donna, again, you're gonna have to give me permission to share my screen. Either that or make me the host again. Great, and so we did put together, as we usually do, let me know that you guys can see my screen here. Everyone can see it okay? Give me a thumbs up. Fantastic.
Yes.
Again, seminar number 3. We struggled with this one for a long time because, our healthcare disclaimer first. Obviously, this is not medical advice. You should go to your doctor for personal nuanced medical advice. But we struggled with a 7th pillar that reflected exercise for a while. We did like the idea of alliteration, which makes them very easy to remember. We finally stumbled across the idea of sweat, right? Sweat is not a exciting term for most of us in today's society, yet it's incredibly important, right, for detoxification and in our second largest organ, our skin, and movement falls under that category. And so as we bring more of these SeeBeyond seminars, we're trying to address these 7 pillars of health. And over again, and this is something we can share. I can see some of you squinting at the screen here. We can share this so everybody gets a copy themselves. But what are those core tenets that form the base of health for everyone? And we've kind of distilled them down to these 7 pillars, which we'll share more with others, that truly prevents the majority of disease. And obviously, what all of us do, including Ed, goes beyond these pillars of health, but using these as kind of a base, we want to move on beyond that. So physical activity, absolutely essential. And I think it's tough because we all know this, right? This is something that's such common knowledge. And yet, like many of the pillars, we constantly have to be reminded, and we constantly have to explore new ways to find ways to engage in these pillars in our everyday life. So I put a couple of things up here that hopefully aren't too much debatable, but just to kind of refocus us on what counts as physical activity. And basically anything that gets us moving, right? And I've seen all kinds of literature, and they teach us in medical school about activity, and that could be from gardening to dancing to obviously high performance athletics, but anything that gets you moving is important. How much do we need to do? And we're gonna get into this a little bit more, and Ed's gonna give us his opinion as well, but most of the research I see is really shooting for 150 minutes, right, of activity per week. A lot of us aren't getting there, but this is what we want to shoot for, some of us much more. And then how long till I see results? And again, this is a very exciting intervention in that we get immediate results. And we'll talk more about this as well as long-term. A recent podcast I listened to, it just really summed it up. And this is from an NFL player, but look good, feel good, play good. The goal of exercise, activity, movement is for us, most of us, we want to look good, right? I have a lot of patients coming to beach time, right? And want to look good on the beach. But even a little bit deeper level is to feel good. And this is probably one of the areas as a physician I get most excited about. But then to play good, right? And that is, life is about being able to maintain that play even as we get older. I like to include in a lot of these discussions something that's maybe fun and out of the ordinary. And this is a very recent publication that researchers, a team, I think it's at Beth Deaconess in Boston, that discovered potentially active metabolite that they could make into a medicine. And so Donna might be able to put up a poll here. If we could switch having to do exercise with just popping a pill, would you do it? Yes or no? I'm seeing a lot of nods. I would like to, not to speak poorly of this research, but it's in its infancy. And what it really focuses on is metabolic health. So if you dig into it, part of it, these are derivatives. LAC-Phi is one of the names that they've given it, of lactic acid, something that's produced by muscles, when we do exercise, that can have a positive impact potentially on metabolic health. Right. And the amazing benefit, and what I love about our pillars, a lot of these therapies aren't just singled out by a chemical, right? They're much more robust. And so this will do nothing to discuss mental health potential benefits, immune potential benefits, bone strength potential benefits, right? Many other benefits that can come from exercise. And while this is exciting and it's in its infancy, and I think that true integrative medicine can marry these worlds, right? If there is a pill that can optimize some of those benefits of exercise and we can still exercise, that might be a perfect world someday well into the future.
Beyond my time.
One thing I'd just like to hint upon too as well, and this is, again, speaking to that last slide, exercise sometimes I see as an antidote to sedentary, lifestyle. And this is really, we talk about many other epidemics and pandemic. This is truly one front and center for the majority of us, and myself included, spending a lot of time behind a desk. And even Ed and I right now, kind of sitting for this, to count up the hours that we're seated during a day are really remarkable. And these slides are too small for you to see, but one of them lists all of the negative impacts of sitting for too long. And many argue that sitting is new smoking. This one front and center I put in there to highlight that all-cause mortality decreases as we move more, meaning that we have a lower chance of dying when we move more, and it's directly proportional. The flip side of this, and I'm very proud to say that I recently got a stand-up desk, and many of you may even come into your visit and find me standing for a second, and I'll put that desk back down, but there are tremendous benefits to standing. So not quite movement, but again, the antidote to a sedentary lifestyle. The benefits of physical activity, we hit on a couple, but just this slide is not big enough to fit them. And at the end, in the kind of seminar notes, is one of my favorite websites that I've probably shared with some of you on the call, and hopefully many of you that listen, that's called 23.5 hours, the single best thing you can do for your health. And, spoiler alert, it discusses exercise, but a few documented benefits: decreased risk of cardiorespiratory disease, so heart and lung disease, increased bone and musculoskeletal health, cardiometabolic and weight management. I say to many patients, as we work with many patients on maintaining a healthy weight or losing weight, that exercise generally is not one of the strongest things to help lose weight, but it's probably the most important factor in preventing the yo-yo, in keeping those pounds off. And then the positive benefits of mental health. I'll share with some patients, there's a specific study that I haven't listed here, and I can probably put in the notes as well. There are some arguments that exercise can be as effective as some of our mainstream antidepressants in terms of helping with depression and mental health. The list goes on, and honestly, there's just not enough space. And I'm trying to get across the point here of why this is one of our pillars. These incredible health benefits that we're all aware of, but reiterating some of the modern science of how important this is and also hopefully motivating all of us, myself included. I'll be honest, of the pillars, activity, exercise, and sweat, right? That sweat group is probably my weakest link, even as a doctor. Immediate results, as we talked about, right after exercising, decreased anxiety, improved sleep, improved thinking, right? Cognitive function, helpful for brain fog. Releasing chemicals like endorphins and serotonin. Long-term benefits, right? Also anxiety, also improving deep sleep, also improving executive function, your ability to think, decreasing the risk of dementia. And again, this other epidemic that is on one of our pillars, right? The isolation, which COVID has caused for many of us, this can be a tremendous benefit of exercise if either we're on a team sport or exercising, in a way that involves others, which many of us are getting back to that as we're putting COVID in the rearview memory. Getting started, I think that this is really important and may be self-explanatory. And just for the record, this is a little bit more of a basic kind of overview lecture. We certainly hope to have more nuanced or, geeking out on some of the research in the future, but just some ideas on getting started. And I say this over and over to my patients, finding that right activity for you, right? Something that's personalized. And any movement counts, right? Every little movement that you do. I sometimes quote a recent study, as little as a 5-minute walk after your biggest meal can impact that A1C. That's your blood sugar marker over a 3-month period of time. And health benefits aren't the only reason we're doing this. So as much as we can, incorporate sunlight, incorporate nature, incorporate social interactions, incorporate stress reduction. If you're not talking, I do just ask you to go on mute, if at all possible. And then, that last thing, let's make sure that it's fun. I think that one of the recent criticisms I've seen of exercise is that many of us try to jump into the real intense boot camp and have tremendous stress or feel really bad the day after. Our chances of continuing on an exercise program are much low if we don't kind of ramp up a little bit more slowly. And that means, feel free to take it easy on yourself and find that enjoyment space of exercise. The chances of that being a pattern are much higher when we do that. And then just one last thing I'd say along that a lot of discussion, and we won't get into this too much, but what exercise is best. And again, this is an entire lecture on its own. Similar to, I get asked a lot, what diet is best, right, for nutrition. What studies have shown for both exercise and nutrition is the one that works best oftentimes is the one that you stick to. And that's where that gamification or having fun is so important, that while there are many forms of activity and movement, that one that you can stick to and obviously doesn't cause injury, that would prevent us from continuing, is most important. And then one last slide, I just wanted to give a hint out to, and I encourage many of my patients, I utilize, not that we're looking to sell a single product, I use the Apple Watch, but gadgets are a fantastic way to really quantify the amount of activity that we have. And if we're doing things from walking to dancing to gardening, it helps us keep track of that movement to see, at what level we're reaching and how many steps we're getting in a day. And a lot of other benefits to trackers if patients are open to wearing them. Again, that objective data, a good kind of regular feedback to patients, oftentimes looks at other parameters, including heart rate variability and other things that are important to exercise. And then also as a motivator. Many of us are competitive. I certainly get through med school, you have to have a competitive streak. And if I can count my steps and I'm going for a specific goal, I'll be pushed to go a little bit further. Ed, I know you wear a Whoop, right?
I do. I wear a Whoop strap here, and it's pictured on your screen. One of the things that we discussed was that I had a functional medicine panel run recently, and some of the reassessment, really, we haven't done further blood work, but what we see is that Whoop is telling me, with some of these things being addressed, that my lifestyle is changing my outcomes. So I'm recovering. I'm getting these green high marks in sleep for the last 2 weeks. I told Dr. Dahmer I'm on the street, and it's so great to be able to see it real time, day to day. any sense of tossed aside about whether these are accurate or not, I'm still ecstatic at seeing those changes.
Yeah, and not to speak to Ed's history here much, but Ed, if I can, sure did a functional medicine panel. And like many of you on the call, we targeted very specific factors within that. And I think many of you are aware too, I'm a stickler for data. Love to see that those interventions, mainly supplements, can make a difference in performance. And we can actually see that on the data on the other side. And that speaks to kind of that holistic approach to health, which will also support healthy function, healthy movement, and hopefully minimize any injuries. So let's get to the expert here. Ed, and maybe if you'll talk to us a little bit about muscle activation technique.
Sure. So thanks so much for having me here today, Dr. Dahmer. I had moved to the area, to the village of Scarsdale, set up practice just after the pandemic, after being exclusively in New York City. And what happened was Dr. Dahmer had reached out to me, as he explained, and this is after me realizing that Scarsdale Integrative SeeBeyond medicine existed and saying, I've got to go and knock on their door and talk about MAT, muscle activation techniques, with someone there. Interestingly enough, it actually happened the opposite way. And that's another, serendipitous moment. MAT, muscle activation techniques, is a modality where we sit somewhere between personal training and physical therapy or orthopedic care. We look to the body to uncover the hidden links, what exists beyond pain, tightness, chronic injury, and essentially muscle imbalances. What's responsible for all of these things? And I gave it away a bit there. What we see is that muscles compensate, they tighten in predictive ways, and we address with a range of motion assessment and a variety of muscle activation techniques, where it could be a hands-on palpation stimulus, it could be the combination of overstress and specific muscle tests and overloads, and then exercise and coming back to a treatment table. But we're able to assess where someone is asymmetrical and compensating and therefore imbalanced, and then how to correct via any one of those techniques. So it's completely different from physical therapy in the sense that we start with baselines around muscle performance, range of motion, pain and tightness, and then real time in the session, we're changing those outcomes by activating inhibited muscles. I often describe it like we have a fuse box here sitting just outside the camera range. And it's kind of like there's nothing wrong with your body's muscles, tendons, ligaments. Let's assume so. But in the same way, your electrical system, your light bulbs, your wiring are all intact, but you still have an outage. You still have lights that don't work or outlets that don't fire. By moving through and testing each of those fuses, we get them to power back up. And in the same way, we check through the muscle system and get muscles back on track so that you're more symmetrical for posture. And then you carry that postural symmetry into symmetrical function.
I see some of you sitting up straight and stretching just as we talk about that, which is the power of that, which I love to see. And I'm going to go off script a little bit. And for me, again, one of the things that impressed me the most, and I think even in a few discussions that Ed and I have had in preparation for this, is the precision by which, Ed and muscle activation technique can go into the human body. And I find it very similar to a lot of what we do at SeeBeyond medicine, the precise testing to find that exact root cause. And also the other similarity is that you can be both proactive and reactive. And then I wonder if you talk a little bit about that I'm sure some people come to you for optimization, and others, they've had an injury. And is there a different way that you address those?
Yeah, so for most people, I see, traditionally I've seen people that are more like in their 40s, 50s, and 60s, where they're starting to experience the breakdowns. They want to continue in their favorite sports like golf or skiing or cycling. And they come in with some breakdown, a chronic injury or a strain. In some cases, it's just generalized tightness, but maybe on one side of the body. And as we uncover, it's so great to have an allied, colleague in this approach. I'm grateful for, because very similarly, we look for these blind spots. What is the traditional system doing to look at this individual and their history? And what we're able to uncover for people is that they may not realize that one hip is torqued back, and there are muscular reasons for that. they overuse one side, whether it's rotation or bending, and that will lead to pain, chronic pain and tightness. In some cases, so this is a recovery strategy from an injury process. But in those same individuals who love their weekend warrior sports like cycling, tennis, golf, skiing, even playing, having downtime with grandchildren and feeling physically vigorous and present, in a lot of ways, those people will they'll elect to continue the process to improve their performance, either through this in sport or in activities of daily living and play.
Good. And I stopped the screen share a little bit just so that we can maybe interact a little bit more rather than see the slides. Ed, you tell us a little bit more about what sets muscle activation techniques apart from other interventions for chronic and acute pain, tightness, and dysfunction.
You know, what's interesting is that traditionally, if you go to an orthopedic surgeon, you're almost aware of what one of the outcomes will be via the name of the practice. So you'll have someone who's a consummate surgeon, evaluating whether you're a candidate for surgery. When we look, and then when you're referred, in many cases, say you have a conservative management plan, if you're referred to a physical therapist, they are going to be legally compelled to only address the area of pain or tightness. In our practice, what we've come to understand is that we will never get at the root causes if we only stay at the area of pain or tightness. So we have a culture of foam rolling, massage, Theraguns, where people are slavishly, or dare I say masochistically, beating up tissue that's actually already inflamed and beaten up. And when we go to a professional in many of the therapeutic modalities, they are only legally able to stick to the areas written in on the prescription pad. So what we will do is look to explain how your trunk function is impacting that weakness in the hip or shoulder. So in many cases, in the very early going, clients will come to me and say, I have a neck problem. Why are we down here in the core and torso? And for us, as practitioners, this is like breathing. You will never get to the root causes of a neck issue, specifically diving into the neck on day one. Many of the torques come from alignment of the torso, hips, etc., then shoulders. So it might be something that you do in a cursory way on day one. The same for any area, right? Shoulders and hips come next. But if the area is painful and inflamed, it could be because it's overworking and it's the last muscle or tendon structure standing, and we want to bring up the strength and function of opposing muscle groups. And it could be that the opposing muscle groups are inflamed because they're trying to do their best and they're just not activated.
So you hinted at a little bit kind of the muscle activation technique process, but maybe fill in the gaps too of like what the process is like for someone that would come and explore muscle activation technique. So
yeah, basically we have a client stand for a postural analysis. We look at whether there's rotation of the shoulders, a side bend, or a dipping of one or both shoulders. We look to see whether the pelvis is rotating, and then we'll look at it on the table from a range perspective. How are the limbs moving? From a side view, is one arm going to here and is one arm going way back here? This might signal to us that some of the musculature that takes you up here is not functioning. And then the next question that comes up is, well, I work that muscle in the gym, or I do that muscle as part of a calisthenics routine every morning or in yoga. And what we actually find, these proprietary techniques of evaluating and testing all of the structures that lift this limb up will be, it will be an exhaustive process. An MAT practitioner is responsible for 276 muscles on either side of the body. It's a vocabulary that you just don't hear about. You have a youth culture around, Instagram and TikTok with short, quick sound bites around bodily training. And, I would say that there are about 30 muscles that you hear about in personal training usage. A physical therapist might have a bigger vocabulary that goes to say 50 or 80 muscles, but a total of 552 muscles, if my math is right. this is a copious workload, and this is exactly what we do. So there are numerous muscles needing address. We evaluate, again, to synopsize, a range of motion. We look at standing stuff, motion stuff, and then a range of motion on the treatment table, evaluating all the working joints for symmetry, time allowing. And that painstaking process of moving through all responsible muscles is really like checking all the fuses in an extensive fuse box of 552 fuses.
And you've hinted at, kind of all ages, right? Both proactive and reactive, but any other kind of words of wisdom for who is muscle activation technique for, or who's it right for? Who's it right?
It's funny, of course, because I'm in this work, I can see where it's applicable for everyone. But if you're experiencing any loss of power in your life and experience of life, any loss of joy in moving and enjoying the simple things like getting out of bed pain-free, sitting and standing from chairs, the favorite sport that you adore doing, and then, quality time with family, friends, loved ones. I get kind of emotional when I talk about this because the longevity path is amazing. As we talk about exercise, there's almost this velvet rope nightclub environment. The bouncer picks two and two are allowed in. But when it comes to exercise, not everyone is going to be able to engage in the 150 minimal minutes, which we'll get into further in a bit, right? If your machine doesn't work, if your car doesn't work, if you've got a check engine light, you don't engage on a cross-country journey. You just wouldn't feel responsible. In the same way, if your ankle is a bit tricky, you wouldn't undertake marathon training. In that way, we have an amazing assessment and treatment modality where we can get that check engine light to go off. The pain, the tightness, the chronic ankle issue to go. A chronic ankle issue for us is a core issue, usually a core and back hip issue. I hope that answers your question.
I think one of the things about the velvet rope that hits home, it's a quote I put at the end of the talk, so we'll get back to it, but it was one of the founders of Nike that said, everyone with a body is an athlete, right? And I think that for a lot of us too, and even I used to be an athlete for a long period of time, when I took a break, I thought, if I can't go back to the level that I was at, it was hard for me to get back into it. But again, breaking down those barriers that any movement is tremendous for our health, right? And breaking down those barriers of, this is a super athlete and these therapies or these exercises are reserved only for people that are, incredible athletes. No, we need to find any activity that works for us because the benefits are so substantial. And Ed, maybe a couple last questions about like a session. Should someone expect to walk out of here sore or not being able to move, or what before and after a session? Like, why don't you tell everyone about what a session is like?
I'm comfortable talking about the fact that as a culture, people like to have hands-on experiences. Like we'll never see people stop going to get their favorite massage, etc. But in an MAT session, it's different because after a massage, if there were a bus headed to you, you might not feel like your wits are about you. You might not feel physically in your body or it's connected. In an MAT session, you should feel more on your toes. You should feel more connected, faster responding and moving with better balance. There could be circumstances where you are a little bit sore because we've addressed something that has, sought attention for a long period of time. So tendons can be inflamed. They will feel like 9 out of 10 times clients will say it's a good pain when it's the tactile thing that we do. Yeah, that's the difference in that you should feel a readiness for physical activity after an MAT session. We also send you out with homework, that none of this stuff would hold. We're looking to change, to reverse, in cases, years, decades of patterning and disuse in some cases, right? One statistic is that if the rotator cuff musculature is not used by the early 60s, it simply atrophies and shrinks away. It simply is taken up by the body. So it becomes disused to a point of no function whatsoever. So this process really is the lifeblood of your physical experience. It's tied to ongoing function and increases in your health span, not just the lifespan, but the usable, active, joyful years of one's life. Yeah.
Good. And then I think the goal, right, that when we come back to the pillars and we talk about sweat and movement is quality of life, right, and health span. How might muscle activation technique, in addition to what we're talking about with exercise and activity, how does that contribute to quality of life?
I think it goes back to that conversation we were having earlier about not being able to partake in various of the fitness elements required for health and longevity. So if you're having trouble with your elbow, you're not going to be out pursuing the joy for tennis. If you're having trouble with your ankle, you're not going to be doing that marathon training, or you're not even going to be able to walk or cycle to pursue any cardiovascular modality to get into this zone 2 cardiovascular training, which we're going to talk about in a moment. Many of the fitness modalities, resistance training is often neglected. It is well known that at any age, one can start resistance training and rebuild muscle size and strength and maintain bone density at any age. People have started in their late 80s, at times in their 90s. So long as you have a moving, workable body, you are invited to that party and you're in that party. But as soon as a joint or a series of joints is dysfunctional, you're no longer able to participate in cardiovascular exercise, resistance training, dance, yoga, martial arts, tennis, cycling, skiing, what have you.
Yeah, I think that's a key point. At any point in our lives that we can increase movement, the benefits are tremendous, right? And again, there are discussions about what is the optimal age, or are there better ages with better returns? But without a doubt, at any age, it's great to engage in movement and to increase the amount that we're doing. And with that said, it's going to get a little bit more into the intensity of movement. I'm going to go back to sharing my screen here so you guys can see this. And Ed, I'll just put this screen up and I'll let you take it away in terms of fitness elements.
Yeah, so I think that Dr. Dahmer, again, the collegial synchronicity is wonderful experience, because we both refer to this as trying to help clients, patients with blind spots. And now we have kind of come to understand from the research community that there are known elements to a fitness program that associate with greater quality of life, cognitive benefits and retention, mood enhancement and maintenance, strength, flexibility, you name it. Of course, the cardiovascular health is the biggest thing that people think about. Now, on your screen there, you'll see that I have a listing of mode, duration, and frequency. So under mode, I have a start as zone 2 cardio, 50 to 60% of your maximal heart rate. Without getting too detailed, this is the kind of cardio that you can perform while talking. It's called the talk test. Sometimes we'll use what's called a rate of perceived exertion scale. And in the talk test, you can maintain a conversation with a friend and get through the exercise. And this is a minimum of 150 minutes a week as a recent recommendation. There's a note there at the bottom, a recent Harvard School of Public Health survey, the nurses study, has found that all cars, now I can tell you that just hitting 150 minutes, you're already reducing by 50% your risk of all-cause mortality. In this particular study, 150 minutes to 300 minutes will take you to a lowered risk, 21%. And they found that those that went over 300 minutes were able to lower as much as 31%. And I want to point out that this is on top of knowing that just getting into 150 minutes of zone 2 training lowers, over 50% right there. So we're going into greater and greater percentages. If you add those together, you start to realize 50 plus 20 plus 30. You're almost reducing your risk of death from all causes completely. Zone 4 and 5, which follows, Recent revelations are that you can really stave off dementia without, this is irrespective of genetic risk factors. Zone 4 and 5 cardio is basically high intensity training. So these are these all out, chased by a tiger intervals, which, frankly, most people are not comfortable with. I took my daughter to the track. She said she wanted to go to the Scarsdale track a few months ago, and she's fast. She's constantly telling me how she beats the boys at age 12. But I'm very proud of her for those stories, by the way. When you consider it, she made herself halfway across the track, half a circuit, and she came back like with her tail between her legs. She said, "Dad, I had no idea how hard it was to go around one time." Well, half of one time is about 200 meters. It's going to take, about, it might take somewhere between 45 or 60 seconds. But I kind of kid myself that I can make people do that in about 30 seconds. All one would have to do is a really challenging speeding up on a bicycle, either a fast walk or breaking into a jog at the outset. And they're trying to get to a real chase by a tiger feeling eventually. Now, I go back to my centerpiece of practice. Most people over age 40, 50 for sure, are not going to be up to that. Even when I get deconditioned and I take my bike straight up one of the hills in town, I will tell you, I can't even get my heart rate anywhere near to 80 to 100%. So remember, the benefit of doing this, and it's much less time, 75 to 150 minutes per week. I got to tell you, it's hard for me to get in 2 25-minute, 2 22-minute workouts. I'm happy if I can get in one. So these are lofty goals. These are the goals set up by some of the preeminent researchers in the industry. So really a great idea. Honestly, I also think sprinting is really challenging on the foot, ankle, and knee. And zone 4 and 5, that's a goal that's challenging for anybody. So I go back to my primary practice, which is helping people to move better, to feel like their bodies are younger again. And that's the goal. That's where MAT intersects with performing zone 2 and zone 4 or 5 cardio.
I want to jump in real quick, because I do think, for me, it's really important about the nuance of finding something that works for you. If you ask me to go to a track and run a sprint, I might do that once. I will never go back. But I'm a very competitive soccer player. And so if you get me on a field, I will hit zone 4 and 5 without even thinking about it. And I think it's important for those on the call and those that listen to this, find that kind of activity that you really enjoy. In my Piermont Community Center, pickleball is the craze, right? And many people are jumping on the pickleball wagon, which is fantastic because it's fun and it's social, but you can get that zone 4 and 5 sometimes even without thinking about it. I just wanted to throw that in there because I think it's so important, the gamification of the exercise and doing something that you enjoy.
Yeah, that's a great point. I want to point out that I've had a couple of soccer goalies over the last year. And Doc, I don't know if you guys can tell, if you met Dr. Dahmer in person, I asked him when we were getting on screen, I said, "How tall are you?" And he said 6'4". And of course I started to profile him. And I said, "I'm going to move my chair forward because I'm about 5'10" and a half, on tiptoe." And these soccer goalies, it's a big responsibility to cover a large space. And if you've ever seen intensity of soccer players, it's a burst. And when that ball gets into your area, you are on the spot. The bodies break down. Their legs are many times extremely flexible. Their arms are long. Dr. Dahmer exemplifies some of this. I'm not sure if we play goalie.
Sometimes.
Height advantage. Yeah. But yeah, it's great to gamify. And that's down there at the very bottom. There's qualitative exercise. Of course, let's point out resistance training is super important for the bones and the muscle size. Muscle volume is now being looked at as, I think there was a cross-section of quadriceps study done in association with cognitive impairments and dementia. And they found that those who had the greatest cross-section of quad muscle had the lowest impairment in cognition. Resistance training is important for maintaining balance and preventing slips and falls, maintaining healthy weight, maintaining that bone density, which really doesn't increase after pubescence. After 20, where none of us are getting more dense in our bones without some serious interventions. Resistance training is also the only way to increase bone density. Most people believe that anything weight bearing creates bone density. Running doesn't do it. Bill Rogers, the famous marathoner, broke his tibia in a training run. So resistance training, even bands body weight increase bone density. Qualitative exercise like yoga, Pilates, sports. We're talking about having experiences, not even timed, and active play. So none of these boxes is really exclusive, right? We can combine them. And I think what Dr. Dahmer is saying, that if you can trick yourself into having a goal, then your focus really changes your perspective on what it is you're doing, and you're hitting those minimums.
We'll bump forward here to.
Yeah, this was just to clarify. When we referred to the heart rate training in the earlier slide, you can see zone 1, I have it coded green because it's very light, and then it gets more and more red, kind of like a traffic light as we go lower. So 50 to 60% of your maximal heart rate. I could have put in underneath the slide that you calculate maximal heart rate 220 minus your age, and then times those percentages. So you know, the heart rate monitors really are an amazing tool, whether it's a Whoop, an Oura Ring, an Apple Watch. But one little sidebar, and this is a little complicated, you've got to be sure that that works for you. I was playing with an Apple Watch for several months. I put one back on for a week, and though I love the metrics, it does impact my biomechanics. It's a little unknown tidbit that your body's an electrical system, and these things will interact. So light cardio is zone 1. That would be like just housework, perhaps. The zone 2 version of light is that where you want to get those 150 to 300 minutes. So that's your walking for most people. For some people, it's light cycling. The moderate, it's great if you have some specific athletic need for that, but most people, especially for longevity, it's not as important. The hard to maximum is that high intensity. Now, I've got to be honest. Right now, when I go for a high intensity workout, I probably only get into the moderate, but I'm a lifetime athletic person. So I've got to condition myself to be able to get up that high. Other people find that their heart rates go very high very soon. So all of this is about figuring out what's right for you. So I talk about that local thing of walking and then picking up the pace, maybe having a heart rate monitor for added detail. But the talk test is very helpful. Get out of breath and then get your breath back.
Good. And then just, kind of highlighted that holistic approach. There are a lot of things that we do at SeeBeyond Medicine. Many of you are probably already aware of that. Many things we can do from a proactive standpoint, as Ed discussed before, that he's even benefiting from in terms of looking at specific markers in the blood, things to optimize to improve performance and function. I put a few of our favorite supplements, the SPM Active and Inflamaway, to help with inflammation in the body, to try to decrease what is a necessary response to injury, but sometimes can go overboard, and we can calm that down from specific supplements. To shockwave therapy, we've been utilizing a lot. Many tendinous injuries. The shockwave therapy has proven very beneficial. You can reach out to us for any information about any of these therapies. And then peptides that many on the call have probably heard about already, but the BPC 157 specifically targeting joint pain, joint mobility, boost recovery from injuries, peptide that we use quite a bit at SeeBeyond Medicine. That, again, for me, integrative medicine is the ability to utilize some of these therapies to support optimal function in conjunction with muscle activation technique and many of these other amazing modalities that do exist to support movement, which I hope everyone is seeing, right, from this seminar thus far, how incredibly important it is. And we all knew that, but to reinforce how important it is. And then just a couple of favorite resources. I discussed that YouTube video, 23.5 hours, single best thing you can do for your health. Encourage you to watch that. I'll list some of these on the YouTube link when we actually post this. Some patients have used a stick. I don't know if you've heard of this before. It's a website where you can actually put some money down and you choose 2 organizations, one you love and one you hate. And if you don't stick to your goal, the money goes to the one that you hate. And many people find that an incredible motivator to stick to their goal. And some of us, it's great to have that additional support. And oftentimes we try to help our own patients with that support. And sometimes we call it holding you accountable, but I think it's just support on the journey. This was a little bit more of an introductory kind of discussion of exercise, but for those looking for a little bit more intensive discussion, one of my favorites is Dr. Attia with Phil Maffetone. I put a link on there on optimizing health and performance. And then another great TED talk that I think is just fantastic. Again, coming back to the gamification. This should be fun, right? It shouldn't just be a duty. And I find over and over, not only in my own life, but with patients, when it's only about a duty, it has a limited time that we're going to continue to do it. Whereby if there is a challenge, a competition, a social aspect, a gamification involved, we have a much better chance of it continuing long term. And then circling back to that same quote, if you have a body, you're an athlete. Bill Bowerman, one of the co-founders of Nike, and links to both muscle activation and SeeBeyond medicine that many of you already be aware of. And we'll pause here for a second. I'm going to stop sharing and see if and open it up for any questions. If you have a question, I'll check the chat here as well. But feel free to unpause yourself and ask that question.
You mentioned about, when you're hot, the heat, your body. I found that 5 years ago, I took the heat off in my bedroom. So I always sleep in the cold. And when I wake up, I don't feel any, I'm not perspiring, and I'm not, my body doesn't feel achy at all. And I've been doing that for 5 years, and I find it helps me not to have any type of heat when I'm sleeping.
Yeah, I'll jump. I speak with patients quite a bit. Cool temperature for sleep is optimal, and especially the head. Being, again, it's relative, depending on how much you can handle, but the cooler the temperature at night for sleep will optimize sleep. And Ed and I were talking about that before kind of the seminar. We didn't even get into it, but how important sleep is for restoration, right? Of not only the musculoskeletal system, but the nervous system, these two that go hand in hand. But, Francis, I think that's a great point. Cool temperature, definitely for sleep. I think that many of us will find that heat is a good way to warm up the musculoskeletal system. Maybe, Ed, you want to talk a little bit more about that? And obviously there's craze of hot yoga and other things. I see Ed grinning, so I'll let you answer that.
I have tried the hot yogurt. I have done it. I don't do it anymore, but I have experienced it. Yes.
Francis, I want to jump in and say that I completely agree with you. And beyond that, I talk about this as a lifestyle thing with my clientele all the time. I am a sleep hacker. I coach people in this way. I sleep on a cooling mattress that's basically like an air conditioner for your mattress pad. And there are some beds, as I understand, that come with this, like the Sleep Number kinds of beds. But there are two brands that I know of. The one I use is called Uller, like without a C. And there's another, they make another product called a Chill Pad, also a weighted blanket that has a cooling element. So anyone that comes to visit, or if I have house guests, they're always like, what is that thing? It looks like your bed has got an air conditioner. And I monitor the temperature of my body under a weighted blanket, where there's also research that we feel almost hugged when we have any kind of a weight on top of us as we sleep. So I agree with you completely. I kind of have through the winter, the AC or the fan on, so that the temperature in the room is somewhere between 65 and 68, which has been found to be the ideal temperature for sleeping.
Well, one thing I agree with you. I have the pillow. I don't have the mattress that you're talking about, but I have a pillow that is a cool pillow when I bought it. So it never gets hot, the pillow that I'm sleeping on. And I don't need the air conditioner or the fan. I find my bedroom in the winter is cold, and I just use a blanket. And I've been doing that for almost 10 to 5 years. So my body temperature is never cold. I don't have that type of body. I'm always medium. So when winter comes for me, I don't have to put tons of layers on. So, but I also want to mention one thing that I've been doing for the past month and a half. I've been doing squats, going up and down, and I do 90, and I notice a difference in bending down a lot more, you know, when I have to pick up stuff. And I notice my back is more stronger. And I just started doing it about a month ago. I'm a walker. Mostly I'm a walker. I did the yoga, I did the hot thing. I stopped doing all that. My more exercise now is just walking a lot. And I've been doing the squats. And I have to say the squats for me has helped me a lot.
Did you say you were doing 90 pounds or 90 repetitions?
90 squats up and down. I made it to 90.
That's a lot. That's impressive.
Well, I started with 10.
Yeah.
And then 20, you know.
So generally, the next step would be to lower the total number and increase some form of resistance, whether you hold, you know, people talk about whether they want to hold dumbbells or milk, you know, it could be any variation of plastic container filled with half water or full water as a first step, like a home routine.
Mm-hmm.
And the science there is clear that when you get up to a number like 90, then the number of reps turns over to not necessarily building muscle size, strength, bone density, though the endurance is, as you say, it's quite high. Switching it up and having the lower number of reps with some resistance is considered a greater stimulus. But again, you want to grade up to that, right? You want to measure that in
So when you do the squats, what you're saying is take some weights instead of doing 90, like just do like 20 with weights.
Yeah, exactly. Holding, you know, anything in your hands, dumbbells.
And for me, would I start off with 5 pounds in a situation like that?
I think that if you're doing 90, we could guess pretty well that you may be able to handle, you know, 12 in each hand conservatively. That's a guess, you know, without.
Well, I think I have to work to that. I'm not a weight person, but I do have 10 pounds. And after 10 repetition, I stop with the 10 pounds.
Well, and the key thing is keeping good technique when you add that weight. Sometimes we add weight and then we compensate by cheating on technique, and that's where I think sometimes we can get in trouble. But you know, gauge where you can still keep that good technique, and then add the pounds. And Francis, you're great at just slowly creeping it up, you know. And you could start even lower, but then you might find that Ed's right, and you can go to 12 pretty easily.
Yeah, it's impressive. 90 is really impressive.
Thanks for the thing about the mattress.
Oh yeah, check that out.
I didn't know about that.
Chilly sleep.
I learned something new.
You know, there's another thing I was going to say is Dr. Dahmer had a slide that we took out. And I think that with squatting, if there were a bare minimum, we'd have to include pushing and pulling. So if you have those dumbbells, you could probably be near to a squat position and just kind of pull up, you know, in your lower part of the squat position for a pulling.
I have this.
Yeah, that's great. That's great. You could actually do the squats while holding that, anchoring with your 2 feet and getting the equivalent of 10 pounds of resistance. So you're holding that under your feet, you're standing up straight and it's stretching, and then lowering down and it's slacking. So that'll stand in. Maybe one under the left foot, one under the right foot eventually. And then pushing as well. So wall push-ups to start, right? So push, pull, squat. You're covering the front of the upper body, the back of the upper body, and then of course the lower body with a catch-all with a squat.
Thank you.
I want to be just cognizant of time. We're trying to keep these on point so that everyone can get back to other activities. I just really want to thank Ed for joining us with his expertise. I want to thank all of you for participating and showing up. I hope that you did learn something, or maybe more than one thing. And just really excited to have more of these in the future. We're always open to feedback. Please share it, right, with friends, family, anybody else that might benefit from it. And let's get out there. Let's keep moving and work up a sweat.
I don't know if I can work up a sweat.
Have a great day. Thank you.
Bye-bye. Bye.
See you.